Ladies and gentlemen, good evening, good morning, good afternoon from wherever you're watching us from. This is the Health and Wellness Spot, and of course, this is Dr. Lewis Muchile Obunde. Everybody's complaining about the sound. We are here. Yeah, mnataka kusikiza siri. Into in-house. So we are here. Welcome back to yet another informative live about diabetes and the medication of diabetes. Now, do you know your drugs for diabetes? Or you just know my diabetes, but you don't know the drugs. Do you know what those trade names mean? That's what we are here for tonight. Do you know how those medications work? Because through knowing and understanding the mode of action of medication for diabetes, you can easily use that to know if these drugs are actually going to help you. You can easily use that also to understand the disease. So welcome on board. Welcome to yet another interesting live. You will never regret it. So thank you so much for being part of us. Thank you so much, Nairobi, for making it happen for us. We appreciate each and every one of you who came in for the physical consultations, everybody who referred people to us. We've changed lives in Nairobi, and you saw the testimony that I shared on my platforms about that gentleman, the army gentleman. That was just tremendous. Tremendous. And I love that. I love these things because that's what we live for. Okay. Another disappointing part of it is we received a message that YouTube is stepping on our videos. Every time we put out a video, they are always there stepping on it to make sure that you people don't get this information. But guess what? We are not going to stop. We are not going to stop. We are going to be louder every single day, courtesy of you, because you are the ones who actually make us. We are not here for the views. We are not here for YouTube. We are here for the generation that we want to see our nation coming to be. We want a healthier nation. We want a healthier continent. And if any case the world aligns to our continent, so be it. But at this moment in time, we are not going to silence ourselves. We're not going to keep quiet. We will be loud. We will be rogue as possible. We will expose all those injustices in healthcare, because we know that some of us, actually most of us, you know somebody who has suffered diabetes. You know somebody who has died of a stroke. Somebody who you know. You have a family member who is suffering from hypertension. You have somebody who is suffering from cancer. And whatever you see in those hospitals, possibly you don't have a reason or a chance to ask these questions. That's why I exist. I am here to bridge that gap, to make sure that you understand health in a language that is easy, and a language that you can actually interpret it and ask questions to the doctors. So that's what I am here to do. And I'll do that until the day that I take my last breath. So thank you so much for joining in. As you join in, kindly remember to tell us where you're watching us from. We need to shout out to people in your area zone. And also, do not forget to like, comment, and just share the live. It's interesting. It's going to be interesting, I promise you that. So share it widely on your platforms so that most people get to join in. And before we start, we must have masses. So I'm allowing you to actually take a minute to actually subscribe to my channel, Health and Wellness Spot. And number two, to also share the live on your WhatsApp, on your Facebook. Please do it, because there are people out there who love to get the same information as you've gotten, but they are unable. They don't know where to find that information. So by you sharing, that means you're helping us grow, as we help you and help other people get this information for free. So thank you for doing that, and thank you for being an honorable person. Amazing. Good. Let's jump into this topic today. Eric Nyabane from Saika. Amazing. Welcome on board. So, ladies and gentlemen, kindly assist me with that. I want to show you something that you people, I know you've never taken keen when you're taking medication. Now, this is not a paid advertisement, okay? This is a medical pack for a drug called Nerva or Nava M. Nava M. So most of us, when you buy a drug, you're buying this. You're buying the brand name. When you see this bigger name here, sometimes it put on an R here, trademark. That means that is just a name from the company. So the company, for example, if I'm making paracetamol, I'll name my paracetamol Chile. Okay? And then I put an R there. So this is the Chile. But that Chile is not the paracetamol. That is my name for my paracetamol. If somebody else is making paracetamol, they will name it their own name, and that will be this. So that's what we're going to call a brand name. So medicines have three names. We have a chemical name, the 2,2-dibromodichloro-3,4,5, aka all that. Very difficult and complicated medical chemical names. That is the chemical name. It identifies the chemical structure of this medication. Number two, we have the generic name. Generic name is paracetamol. So if I say paracetamol here, somebody from Uganda will know what paracetamol is. Somebody from the United States will know what paracetamol is. Okay? So if I say Panadol, it's only us in Kenya who understand Panadol. Somebody in Nigeria does not know that. Maybe they know Naladol for paracetamol. Okay, so that's the brand name. But the generic name is the universal name for every drug. Like metformin is a universal name. Glucophage is not a universal name. Okay? Like sitagliptin is a universal name. And the Triviamate is not a universal name, it's a brand name. So that is the second name. So we have the chemical name, and then we have now the generic name that is supposed to be prescribed. So doctors are supposed to prescribe in generic names. So when you see a doctor writing this name, the bigger name, this Nava M or Triviamate, that doctor, chances are high he's getting something from that prescription. He's getting a commission from that prescription, because doctors are designed to prescribe. They're actually taught to prescribe in generic names. So you don't write Brufen, you write Ibuprofen. You don't write Flagyl, you write Metronidazole. You don't write Sodamoja, you write paracetamol. So that's how it's supposed to be. So when the doctor writes Triviamate, be sure either these people from this company have approached him in the name of medical representatives, the med reps. Cosmas, I see you, from Narok. So either they have been approached and they have been told to push this drug. They use the word push, daktari sukuma hii dawa. Or they are receiving a commission from the chemist that they are going to buy these drugs from. That's why they'll tell you, enda ununue hii kwa chemist fulani. So that brand name. So this is now the brand name. So that's the third name. So the chemical name for the chemical structure, the generic name, which is a universal name that is supposed to be used for prescribing and dispensing, generic name. So the generic name is what you should pay attention to. You see down here we have Nevara M, but down here we have pregabalin 75 milligrams and methylcobalamin 750 milligrams. So this is a combination of two drugs, that is pregabalin for the nerves and methylcobalamin, also a supplement. You see? So those are the drugs that you're taking. You're not taking Neva M, no. You're taking pregabalin and methylcobalamin. So always when you buy a medication, do not pay attention to this bigger name. Pay attention to what is written here. Sometimes you turn it back and you will see each hard gelatin capsule contains 75 milligrams of pregabalin and 750 milligrams of methylcobalamin. So every time you buy a drug, please go here where they have written composition. That is what you should pay attention to, because that is what you're actually taking. But when you pay attention to this big name, you're paying attention to the companies, you're paying attention to the brand. Okay? So understand that, because most of you tell me, oh, nimeandikiwa Triviamate, oh, nimeandikiwa sijui Ozempic. I'm like, Ozempic is a trade name for a drug called semaglutide, and that's what we are here for tonight. Because we are going to discuss all these groups of drugs for the classification, actually the pharmacological classification of drugs for diabetes. And then I will tell you the names that they use in the markets. And then I will tell you the names that they use for the drug combinations. And most importantly, I'll tell you the mode of action, how these drugs act. How do they work? And then I'll mention to you the side effects of each group. So I'll not mention side effects of each drug, no. I will mention side effects of each group, each classification. Because we have about 9 classifications, but I'll handle the 7 ones, the 7 that we all have an encounter with. The 8th will be the insulin therapy. We've talked about insulin therapy before, so today we'll not talk about insulin therapy. But interestingly, you realize these drugs are classified into just 2 major classes. The ones that are going to enhance secretion of insulin, and the ones that are going to enhance the action or the sensitivity of insulin to the cells. So one is producing insulin, helping in production of insulin. Another group is helping this produced insulin to actually be active on the cells. But let me take you back a little bit. We have had this conversation about diabetes before. And we said that if you pay attention to what is in blood, the sugars that are in your blood, you're actually missing out on the point. Because what is in blood is not diabetes. It is a symptom of diabetes. Hyperglycemia is a symptom of diabetes. So I think the medical system has designed us to constantly treat that symptom in blood and not focus on where this sugar is going to. Ask yourself, if I've bought this drug for diabetes and I've been taking it for 10 years, but I still have these sugars in my system, where do you think these drugs are taking the sugars to? Ask that question. Please, one day ask your doctor, Daktari, yes, you're writing this prescription for me, 4 drugs of diabetes, even combinations. But please tell me, where are these drugs going to take these sugars to? Because I expect this sugar to get out of my system. Now listen to your doctor telling you, you know what? These drugs are going to help you to get sugar from the blood into the cells. But sir, if I have hypoglycemia, let's say I have hypoglycemia, I take insulin in short, and then it takes him to hypoglycemia, right? So it has removed sugar from blood and it has sent it into the cells. Have I healed from diabetes? Ladies and gentlemen, take this statement very seriously. Because I've seen a lot of clients who are suffering from diabetic foot ulcers. Their legs are being chopped off. I've seen clients who are suffering from a kidney problem. People losing their eyesight. They have done all this surgery to peel off their eyes all the time. People having strokes. People having heart attacks as complications of diabetes, but they are still on high doses of drugs for diabetes. That's why I come in to ask these questions without fear or contradiction. So ask your doctor, yes, this drug is going to lower my blood sugars, but where is it going to take these sugars to? So is diabetes in blood or is it in the cells in the body? And if it is in the cells in the body, why are we pumping more sugar from blood into those cells? Are we not supposed to get it out? And you will realize there is only one group of drugs for diabetes that will actually get sugars out of the body. One classification of drugs for diabetes that will get sugar out of the body. Unfortunately, that same drug will expose you to urinary tract infections, constant urinary tract infections, kidney failure, and heart attack. And we will talk about it. Interesting, right? So tonight is going to be dangerous. Brace yourself, just sit back and let me do my thing. If you've not subscribed on my YouTube channel, Health and Wellness Spot is a home of healthcare. You can't miss on free content that comes in every single day. Also remember, we are going to meet on Friday for Identity Fridays on Hose with Dr. Lewis. Oh, it's going to be interesting. So we fix your physical here. On Friday, we are busy fixing your spiritual and your mental. So you can't miss out on that. And I can see how people are so confused out there, thinking that I am now becoming this counselor and all that. I'm telling you, yes, you can feel whichever way you want to feel or however way you want to feel. That's your own problem. I am here to fix human beings from inside out. So if the shoe fits, please wear it. If I say things that don't go well with you, you are allowed to actually just scroll and keep moving. Okay? Yeah. So we are not here to massage egos. We are here to say it the way it is. And whoever gets hurt, welcome on Friday at 8 p.m. and just settle down. We clear all those emotions and all that estrogen. Okay? Good. So we have already talked about this. So don't pay attention to this. And you will see TriviaMate is written in this mode. Read these smaller drugs, these smaller names here. Or turn the box or turn the package and simply look at where there is composition. Where there's composition, that's where the medications are. That's what you should pay attention to. And your doctor should actually write using those generic names, not writing these trade names or these brand names. That is not prescribing. That is selling drugs. Pharmacists in the building, don't sell drugs, dispense medications. Good. So when you ask your doctor where these medications are going to take the sugars to, wait until you see him getting upset. Why are you asking so many questions? Wait until he starts telling you, have you been consuming content from that doctor online? And you realize, oh, this one has estrogen. So I have to sit back and ask him even more questions that are going to actually make him melt. Because we have to melt that ego. So if you have been diagnosed with diabetes, your major role is to empty the stores, not to fill the stores. Is to get sugar out of the system, not to load sugar into the system by using medications that are treating symptoms, but they are not even treating the symptoms. They are just changing where the sugar is. They are getting the sugar from the blood, sending it into the fat cells or the muscle cells. But for heaven's sake, I am already diabetic, so which means my system has a lot of sugars that are supposed to be utilized and removed from the body. So then why are we pumping sugar into the same cells that don't want the sugars? Anyway, questions that will need to be answered by your doctor, your endocrinologist, your diabetologist. He will need to answer those questions one day. Now, these are the drugs for diabetes. Basically, this is the classification of medication for diabetes. Okay? Now, this is where you become a pharmacist without even wanting to. Class number 1. The first line is called the Biguanides. So write down Biguanides. Biguanides. You see, they are just called big. They are just big. It's a big business. Anyway, Biguanides. And the number one drug in this classification is called metformin. So when you're taking that drug called metformin, you're actually taking a drug from the classification of drugs called Biguanides. There are other drugs in this classification, but they were removed because they cause you lactic acidosis. They cause you high acids in the system. They lower the pH. You have problems. Maki, that is what I'm talking about. Biguanides. Now, metformin. There is another drug that you people did not know that can actually lower blood sugars, and it comes from this group, and it's an anti-malarial drug. Now, you've heard of when you go to hospitals and you take a malaria test, the RDT, and you're told, oh, hauna malaria, okay, you don't have malaria, but chances are there is malaria hidden in your liver. Have you heard of that statement? That, you know what? That the tests are showing you're negative. The test for negative for malaria, it was negative. But now the doctor has to convince you, because he has to give you a prescription for the AL, the 𝗵𝗡𝗏𝗡𝗏 or a tesunet injection. I mean, we have to get something from that insurance, right? So the doctor convinces you, you know what? There might be no malaria in your blood, but some of it is hidden in the liver. Have you heard of that statement? And then goes ahead and gives you a 𝗵𝗡𝗏𝗏𝗡, the AL. You people call it Lonart, whatever the brand name. Now, this is a drug that is supposed to target malaria in the blood, the red blood cell cycle, that phase. It cannot destroy malaria that is in the liver. So basically, that's a useless drug on that prescription. Hello? Yeah, there are drugs that are supposed to treat malaria that is, we call it hypnozoids. Those that, hypno means sleep. So there are those parasites for malaria. When the life cycle happens in the liver, of course, they undergo the sleeping phase. We call it the hypnosis stage. So they go through the sleeping phase, and they will come back later to cause you malaria later. But that is only for oval, Plasmodium ovale. That's very, very notorious for relapse of malaria. Now, when you're treating the relapse malaria, those that went into hypnosis, you don't use a 𝗵𝗡𝗏𝗏𝗡𝗏, no. You use Proguanil. Sounds like a Luo name, right? Proguanil. So Proguanil is another medication that can actually lower your blood sugars. So that is one drug that people did not know. It is actually in the group of drugs for diabetes, the classification of drugs for diabetes. Now, there's also another one that, you know, ladies, when you've given birth, your child, let me just clear this. Your child, on their umbilical cord, there's that gel that is applied there to actually prevent infections. How many know that gel by name? There's that gel that is applied on the umbilical cord to actually make sure that the umbilical cord does not get infected. Do you know that name? Please, if you know that name, and if you're a medic here, please put it in the comment section. That is a medication that actually comes from the same group that is called the Biguanides. Faye Mutemi, I can't. You're amazing. If you know that medication is coming from this group. So some of these medications are actually going to lower blood sugars, and we just don't know, right? And then somebody will ask, but how will this drug that you're applying on the umbilical cord lower blood sugars? But you see, the skin is an absorbing surface. It's an absorbing surface. So, but anyway, today we're not here to tackle clohexidine. Yes, it's called clohexidine. Thank you for that. So we're not here to tackle clohexidine. We're not here to tackle Proguanil. But I wanted you to know that. So we are here to tackle metformin. Metformin is very common in every prescription for diabetes, because it is the first line, it is a standard medication, it has minimal side effects. And the amazing part about metformin is it will not take you into hypoglycemia. It is called a euglycemic agent, so it cannot take you into hypo. And that's why it's a first-line medication. However, how does it act, and then what are the side effects? Number one, the mode of action of metformin is, one, there are actually several. So number one, it reduces hepatic glucose production. Now, hepatic liver. Okay, so in the liver, there are multiple channels under which we produce glucose. And this is why I should tell you this for free, that Carbohydrates are not the only energy-giving foods. When proteins and amino acids get into the liver, when fats get into the liver, there is something called gluconeogenesis. Gluco for glucose, neo for new, and then genesis, generate. So you're generating glucose from new sources that are not carbohydrates, and that is amino acids from proteins and also triglycerides from fats. Do you understand that now? So metformin blocks the liver from undergoing or from doing that process called gluconeogenesis. So therefore you will not produce any glucose from amino acids, you will not produce any glucose from the fats. So we now lower blood glucose levels because nothing is coming from the liver into the bloodstream in terms of glucose. That is number one. Mode of action number two, it increases insulin sensitivity. So that means it makes sure that glucose in blood is now pumped into the muscle cells for utilization or into the fat cells for storage. That is where we start questioning the system, because number one, why are we increasing insulin sensitivity when the cells are already resisting this insulin? Hello? Why are we focusing on the insulin production and increasing its sensitivity when we know we are already diabetic? So our fat cells are already having enough glucose. We need to burn it out. Our muscle cells are unable to utilize the glucose that is there. That's why we are diabetic anyway. So why are we increasing insulin sensitivity so that we can keep pushing sugar from the blood into these cells? Does that make sense to you? Why? So mode of action number two, questionable. Mode of action number three, it decreases glucose uptake in the intestines. That makes sense, right? But again, question it. Why would we reduce glucose uptake in the intestines instead of just not eating the carbs? Hello? Free therapy. So if we want to reduce glucose uptake from the intestines, we don't need to eat the carbohydrates, because we already know carbohydrates are the most useless meals because they don't serve us any purpose apart from giving us useless energy, that is glucose. They are giving us empty calories, only glucose, no minerals, no essential minerals and amino acids, no nothing. It's just glucose. And since we can simply get this glucose from amino acids, which is protein, and from the fats, why then should we consume carbohydrates? And we all know that the only reason why we're consuming carbohydrates is because we are sugar addicts in denial. You don't eat ugali because you need energy. No, you eat ugali because you're an addict to sugar, but you are in denial. You will never accept it. You don't eat a fruit because it has vitamins. You eat a fruit because it has sugar. If I remove sugar from the fruit, nobody eats the fruit because you don't know the taste of vitamins. But if I remove the vitamins and I leave the sugar, you will constantly consume the fruits and say, oh, they have vitamins. You are a sugar addict, but in denial. Amazing stuff, right? Hey, me nakula mangoes kwa sababu ziko na vitamins. Which vitamin is in mangoes and is absent in vegetables? Why don't you snack on vegetables? Let's continue. So those are the three mode of actions of metformin. I hope you are here, you are getting it. So all these mode of actions, the only one that makes sense is blocking absorption of glucose from the intestines. But that is easy to handle. Stop eating the carbohydrates, you will not need the metformin. Good. And what are the side effects of metformin? Because that's what we are here for. Now, metformin exists in different names. Of course, you know of glucophage, you know of glucomet and all that. These are the trade names. But metformin is the active ingredient. It is the generic name. Doc, what are the methods of removing sugar from the body? Number one, do not eat carbohydrates so that you don't load the stores. Number two, start fasting so that you burn what you stored. Simple. Simple question, very good answer. Clap for me, gentlemen. Hey, somebody's here with their mangoes. Enjoy those mangoes, but realize that you're taking in fructose and glucose at the same time. So you're not taking in any vitamins, because the body is not stupid to take something that doesn't give it a reward. Let's continue. So the side effects of metformin, or the side effects of drugs from this class called the Biguanides. Apparently metformin is the only one that is always present in that group, and it's very present in different combinations because it has a low glycemic, it's euglycemic, so it doesn't cause low sugar levels. It's also very, very affordable and very available. Okay, and you've seen it being used nowadays in PCOS, women who are suffering from polycystic ovarian syndrome. These women who are growing beards, they're using metformin. Do you ever ask yourself why they're using metformin? Because they want to improve insulin sensitivity, because PCOS is a symptom of insulin resistance. So ladies, as you grow fat, what do you expect? PCOS is coming. You will be lucky to miss it out, but you'll have hormonal imbalances, as they call it. Then they'll give you metformin. Then you'll wonder, but this is a drug for people who have diabetes. No, you have insulin resistance. Therefore, you have to get the drug. So change the kitchen, lose the weight. PCOS disappears. You don't need the drug to fix the symptoms of insulin resistance. Does that make sense? Because the best way to improve sensitivity of insulin is not taking metformin, is fasting. Higher. So number one, all the gut problems, nausea, vomiting, abdominal upsets, those are present in every medication. So don't even worry about those. If you're asked any side effect of any medication, just start nausea, vomiting, diarrhea, and constipation. You have your mark. Let's go. Number two, lactic acidosis. Now, there was a drug in this group that was called metformin. That one was the worst with this lactic acidosis. But metformin, this one comes in later on after consuming it for a long period of time. So it's a little bit safer on this one. But it causes you lactic acidosis, which is excessive buildup of lactic acid in your bloodstream. Now, when you build up the acids in the bloodstream, what happens is, because it blocks the clearance of lactic acid from the kidneys and the liver. So now you build up lactic acid in the system. When you build up lactic acid in the system, that means your system is going into acidic pH. It's low pH, and your cells cannot survive under low pH. So they start dying. And this can actually cause you metabolic acidosis, which can give you a heart attack and a kidney failure. So you start with a kidney failure, then a heart attack, and then boom, you're gone. So this will cause kidney impairment. That's another side effect coming in as metabolic acidosis, the lactic acidosis, right? So kidney failure, we have severe heart attack and severe liver disease. So now, we wanted to treat diabetes, ended up getting more problems. Hey. Hey. And the worst part about this lactic acidosis, and this to people who have diabetes and they still drink alcohol. Alcohol will actually exacerbate this condition because alcohol will cause more lactic acidosis. Therefore, so the worst thing you can do to yourself is to drink alcohol when you're on drugs for diabetes. One, you'll cause yourself a fatty liver, which will cause more insulin resistance. That is more diabetes and obesity. And number two, now you'll have lactic acidosis because metformin is a constant drug in those prescriptions. So now more problems. Are we together? Good. Any question? Any question up to there? Amazing stuff. That is number one group, or that is number one classification. So let's go to number two because you have no questions for that. Group number two, the most common one is called the sulfonylureas. You can also put it in the comment section. Sulfonylureas. From just the way I'm just sounding it, write it that way. Do not even care about the spelling because in science, we don't care about the spelling. Sulfonylureas. Now, this is where your no-gluc comes in. This is where amaryl comes in. So there are these types of group. One examples of these drugs in this group. Number one is what we call glipizide. When I say glipizide, people will think, this guy is very complicated. What is glipizide? So let me tell you what glipizide is in your understanding, in the brand name. One, if you're taking a drug with the brand name called Diactin, that is glipizide, or glucotrol, or glipewell, that is glipizide. Number two drug in this group is called glimepiride. Glimepiride is what you people call amaryl. So if you're taking a drug that has amaryl on it, Maki, sulfonylurea, add an S at the end of that statement. It is sulfonylureas. Let me just type it on my YouTube here so that people can actually understand what I'm talking about. Sulfonylureas. That is the drug. No, the classification number two. So sulfonylureas. So we've said glipizide, diactin, glucotrol, and glipewell. And then we've said glimepiride, which is amaryl. We've said gliclazide, which is diamicron. This is very common, right? Diamicron. Diamicron is basically known by a generic name called gliclazide. Diamicron. Number four is a drug called glibeniclamide, no gluc. Okay? There's another one called gliburide, which is diabeta or micronase. So if your doctor writes micronase or no-gluc or diamicron, I see diamicron all the time, or amaryl or diactin, that doctor is basically promoting a certain type of company. They are supposed to write glimepiride or glipizide or tolbutamide or glibeniclamide so that you dispense not with the buyers of an industry, not with the buyers of a company, but with the understanding of generic medications. Generic naming. Okay, so now if you have drugs in that category, and of course most of these are combined with metformin, right? So when you have this, that is what we call the sulfonylureas. The major side effect in this is hypoglycemia. They take you into hypo, you get so confused, you get sweating, you get tremors, and you want just to eat. You feel so hungry, and the next thing you're getting there, you want to put it in your mouth. Apparently, you will not run to eat boiled eggs. No, because the body does not want you to eat eggs. It will send you into eating carbohydrates. So you want sugar. And again, your doctor is seated there telling you, when you experience this side effect, you must carry sweets in your pocket. You go and run and buy the Afia juice and drink it, or Coke Zero and drink it to boost your blood sugars. So you will never be in a stable environment. Your body will always be, you are suffering from the side effects of these drugs, hypoglycemia. Now you're feeling hungry. You take a snack, the biscuits, the juice, the sweets, the sugar. When you take them, they take your blood sugars up. Now you need a drug again to bring it down. You are always in this unstable state. And as long as you're in that unstable state, we as the pharmaceutical companies will love you. We love you. We will feed the disease to bring back a drug to lower the side effects. You will go to hospital, you're given brown bread and sugar in form of fruits, and then you're given these drugs to lower the blood sugars. You go into hypo, they realize you're fainting or you're confused and that you're becoming irritable, they give you yogurt. They give you soda. Soda takes it up, they pump you with insulin. So what is the mode of action of these drugs that make you get into hypo? From that statement, you'll easily understand they stimulate the pancreas to produce insulin. So when they stimulate the pancreas to produce insulin, you go into hypo. That's a problem to somebody who is diabetic. And then they will make you believe that you went into hypo because you fasted. Fasting will never take you into hypo, because when you fast, the body stops utilizing glucose. It simply turns to your stores, the fat cells, to burn the stores. The liver is not stupid. It simply turns to the stores and burn the stores to give you different forms of energy. You see? So it will give you the ketone bodies. It will give you even more glucose to maintain blood sugars. But because they don't want you to drop the medication, they'll constantly tell you that fasting is the one that took you into hypoglycemia. That's a lie. We know when you fast and you take drugs for diabetes, you go into hypoglycemia. We know very well, without even fasting, and you take a sulfonylurea, you'll go into hypoglycemia. Why are they not talking about that? We know very well, if you don't fast and you take insulin therapy, hypoglycemia. That's a side effect. So where is fasting coming in here? Let's not lie. Tusidanganyane. Tawe. So if you're taking diamicron, no-gluc, amaryl, expect that you can go into hypo. You see that? And imagine if it's a combination of now no-gluc plus metformin. Problems. You can go into hypo so fast. Now, this information is not to tell you to drop your medication. Please, those people who constantly drop their medication and they say, I heard Dr. Lewis saying this. That's your own problem. Dr. Lewis also talks about diets. You've never implemented anywhere the diets and the lifestyle, the exercise. You've never implemented anything. Now you just want to drop drugs just because you heard me talking about medication. That will be your own problem. Okay, so my information is to open up your head to know that medication for diabetes are not going to change your situation that much. They are going to just fix the symptoms. They will let the disease establish itself. So therefore, it's up to you to change where the disease came from, the kitchen. And as you use drugs temporarily, you change the kitchen. And now when your blood sugar stabilizes, talk to your doctor to start tapering down the medication. You know, just drop drugs and say, you know what, Dr. Lewis said I should fast. No, there's a step. You must go through different steps to come there. Story for another day. So just concentrate, understand it, open your eyes, and keep moving. Good. So how do they work? We say they increase, or they actually cause the pancreas to produce more insulin. Now already, you've been consuming a lot of carbohydrates and you've worn out your pancreas. Okay, you've worn out the pancreas because it has done its job, got tired you've brought in so much sugar and it's actually gotten tired. By the time you're getting diabetic, the pancreas was getting tired. And now we still tell the same pancreas to produce some more insulin. Sasa zingine nakaa hivi nashangaa, kwani nilikuwa nasoma hivi tu niko wapi? Kwa dirisha manini. Anyway. So these are the drugs that are called, this is a group of drugs that are called the secretagogues. Secretagogues. Secrete, produce. So they enhance the pancreas to produce more insulin. Another question comes in here. If I've been diagnosed with diabetes, I am insulin resistant. So why are you increasing insulin anymore? My cells do not want the insulin. Why are you bringing in insulin? Hello? Are you getting my point? Munashika? Tunanyita? I am insulin resistant. The worst you can do to me is increase insulin. So why are you giving me insulin therapy? Why are you giving me sulfonylureas? Why are you increasing production of the insulin? Ama aje daktari? Ama mtaanza kuniambia hii ni type 1 diabetes. This is type 1. Don't worry. This now, but there are people who are type 2 diabetic and they are given these drugs. They are insulin resistant already, but they are on these drugs. So how do you say about this, daktari? Whips. Haya. Side effects. What is the side effect number 1 of these drugs? Ladies and gentlemen, don't be a boring listener. What is the side effect, number 1 side effect of insulin and drugs that produce insulin? The sulfonylureas. I've already mentioned it, but I want to see if you're sleeping. Kama umekaa huko nyuma unasikia tu zikipita. Me diabetes is a chronic lifestyle condition. I can't do anything about it. I was told I will take diamicron for a lifetime. What is the number 1 side effect of these drugs? I like this thinking. You see, let me tell you, I like this type of thinking, that when I said that every time you're asked about side effects of drugs, just mention nausea, vomiting, diarrhea, and abdominal upset. Thank you very much. Don't complicate medicine. Don't. Usiende ati unataka kusema anza na hapo. After that, when you've mentioned the GI upsets, because you have to start there. After GI upset, now you can go to hypoglycemia, low blood sugars, and then where are these sugars going to? They are going into the fat cells, therefore weight gain. They are very well known for weight gain. Somebody has mentioned heart pulse change. Thank you so much, Kasim, for mentioning that. Allergic reactions, Julie. Thank you for that. Hypoglycemia, Safia. I appreciate that. Heart attack, Jay. Thank you so much. So this is the side effects of these sulfonylureas. Number 1, because they are causing you production of insulin, and insulin is a hypoglycemic agent, you're going to go into hypoglycemia. You're going to experience sweating, confusion, vision problems, dizziness, anger, a lot of hunger. So anger, okay, let's use anger and hunger. Have you seen how angry you become when you are hungry? Hey, that is just a rhyme. I think Nyashinski should take me in one of his songs. I just do a hook. Have you seen yourself angry when you are hungry? Hey, my friend, you just want to grab the nearest sugar and just lick it and just get back to normal. This is exactly what was happening to my father when he was taking no-gluc. Oh, that guy will sweat and he doesn't even know he's sweating. I'm there trying to wipe him. I'm like, hey, Dad, are you okay? He's like, no, son, no, don't worry. I'm okay. But you're sweating. He's like, you're in kawaida. Daktari aliniambia anaweza pata sweating kidogo hapa na hapo. And apparently he didn't even feel when the sweat is moving down his cheeks. He doesn't even feel it. Oh, my friend, my journey has been very personal. So if you hear me talking about these things with a lot of in-depth, I know what I'm talking about. I saw that gentleman almost going into the grave because of this hypoglycemia. And then in his car, he used to have all these Afia juices. 1 liter of each. He's driving, he sees that blood vision is now, hey, he has to take that juice and gulp a whole liter. And then now he's like, hey, now I can drive. Now I'm seeing well. I'm like, but you are feeding this disease, sir. At that moment in time, he didn't listen. He didn't understand what I'm talking about. And now, if you tell him to take that juice, he'll tell you, where. So I understand your doubt. When I talk about these things, I understand your doubt. I understand your fear. that if you drop any medication and you start leading a healthy life in form of the kitchen, everybody will be singing into your ears. You're going to faint. You're going to die. You see, there's something actually that is called, I think, I learned this, I don't know where I had this from, one client or so. She told me that the doctor told her that even if she takes 1 year with stable blood sugars, because she's type 1 diabetic, type 1, okay? So if she goes even 1 year without taking insulin therapy, she should never drop the insulin. And then I asked her why. She told me the doctor told him that doctors around the world have actually said that this is a honeymoon phase. Imagine that crazy stuff. That, you know what, diabetes can actually simply come back even after a year. That is what we call a honeymoon phase. And diabetes has gone into a honeymoon phase. Doctors around the world, they have said that now diabetes has gotten married, it has gone into a honeymoon phase. If you stop insulin therapy, it's going to come back after the honeymoon. Possibly pregnant, right? Hey, daktari. Honeymoon 1 year. Tawe. Fungua chemist bwana. Okay, so hypoglycemia is there. Okay, number 2, weight gain and obesity. But what are we trying to focus on? Most of the people who are diabetic are obese. They have a fatty liver. So we give them drugs that actually cause more problems. Right? Hey, honeymoon. So weight gain and obesity. Increased cardiovascular risk. When you hear cardiovascular, we are talking about cardio, the heart, and vascular, blood vessels. So we are talking about the heart attacks. We are talking about arrhythmias, which is abdominal rhythms. We are talking about the strokes. We are also talking about the shutting out of the heart and all these things that are concerning the heart and the blood vessels. Also, it interrupts with potassium, and you know how potassium is very crazy, very limited in the bloodstream. A small amount of potassium going up, heart failure. This is not me. These are the side effects of these drugs. Number 3, should I say more diabetes? They will come for me. Number 4, dark urine and skin allergies. We move. Those are the sulfonylureas. So you have them on your medication list. Start thinking twice. Number 3, group of drugs. Do you have a question on the sulfonylureas before I proceed? Because I want to do away with this topic completely. The only thing that we'll be getting will be short videos that are explaining this mode of action of these drugs and side effects of each group later on. Do you have a question for me before I proceed? It's only that you didn't open the voice of one doc I went to see, where some doctors are lost. Let me tell you, I don't receive hatred from the public. Why? The only reason why I don't receive hatred from the public is because it is working for them. Oh, most of the public, they try my things and it works for them. And they're like, yeah, kumbe. And then now they come back to give their testimonies on Testimonial Tuesdays. But I have a problem with doctors because they have a problem with me. And the reason why they have a problem with me is because their patients are getting better. The patients are getting better. They wanted to introduce Ozempic to you, but they realize you've lost weight 4 months down the line. They're wondering, sasa biashara imeenda aje? And they have been contracted to sell you that medication. So the more diabetic you are, the better the healthcare systems. Choose you. Ladies and gentlemen, allow me to take a break and introduce my platforms. I have 2 platforms on YouTube. One is Health and Wellness Spot, the one that you're doing a live on right now. That's a very, very informative platform. Go there and subscribe on that platform. Health and Wellness Spot on YouTube. Number 2, we have a second YouTube channel that is called Dr. Lewis. If you don't find it that way, simply type HAWS, HAWS with Dr. Lewis. That is a channel that we actually do the Identity Fridays. So the Friday shows at 8 that are involved in fixing your identities and your mindset. They are happening on that platform, not this Health and Wellness Spot, the other platform. This one is specifically for health issues. The other one is health issues, but the spiritual issues and the mental issues. So join there, because on Friday we're having our live on that platform. It's called Identity Fridays. Go there and enjoy free content again. Number 3, we have merchandise that we are selling to you. We've taught you how to make it. If you're unable to make it, contact us. Those merchandise are actually being delivered to you from Imenti House or from my office in Lavington. Fermented cabbages, Roasted and grounded coffee. I am not in any partnership with anybody. So do not be lied to that, you know what, this is coming from me and Dr. Lewis. No, I am not in any partnership with anybody whatsoever. Any nutritionist, any pharmacist, any medical officer that you see online or that you see who tells you that me and him we are working together, no, we are not. We might share the same gospel, but we're not working together with anybody until I tell you that. So do not be conned. I have a platform on Telegram that is called Health and Wellness Sport. That platform has super information. It's a mini library. You can't miss out on that. Go and join Telegram. Do not go and search porn sites. Go and join Telegram and search Health and Wellness Sport. You will find that channel. Dr. Lewis is there telling you this information every single day on different posts. I also have a platform that is very healthy on Facebook. It's called Lewis Muchile. So if you join all these platforms, you might think you're helping me grow. That is true, but I am actually helping you to get a mini library of health information for free. And then, if you'd like to have a consultation with us, there's a contact that we provide every single time that is used to book for those consultations. So do not come on that contact and tell me that you need me to help you. Oh, doc, you know, I'm niko chini, daktari nisaidie. Trust me, I have helped you enough because I've done all this information and I've actually made it in the easiest, I've delivered it in the easiest way possible. You can get the information everywhere. But your problem is you will simply bash me on one video and then come into my inbox, you want help. That is not going to happen. I have time to do other things. Therefore, let's respect each other's space. When we are here, we're having this conversation, we can roll any conversation that is necessary. When I get out of here, there are other things that I'm doing that I have to attend to 100%, including people who have actually paid for my time to actually deliver this information to them. So please, if you want to talk to me in private or in person, simply book an appointment. And the number is going to be here. It's always on my videos. 0707074722. 0707074722. So 0707074722. Yes, that is my contact. I've pinned it on YouTube. I hope somebody can pin it on TikTok. But again, on my bio on TikTok is always there. So use that contact to book an appointment so that we can actually have that conversation with you. We reserve a space for you to have these conversations. That is for the online conversations and online consultations. We also run physical consultations in Nairobi. And let me just confirm the dates here before I tell it to you. So I hope you can actually start booking for those consultations now. Kekeli has pinned it on TikTok. 0707074722. Yes. So from the week that starts on 24th all the way to the 7th of March, we will be in Nairobi. So you can actually start booking your appointments now. Those of you who keep on telling me, oh, daktari, umetoka mapema. I work on appointments. That's why you'll never find our offices staffed with people. No, we actually make sure that we give you an hour each, and we make sure that hour is enough for each one of you, so that we don't have these people cramming all in that office and all that. No, we want to have some order, because God is a God of order. So are we. So from the 24th of February all the way to the 7th of March, that is the time that we will be doing our physical consultations in Nairobi. So you can actually start booking your appointments at this moment in time for that time. So do not wait until that time and now you start complaining, oh, you know what, I've missed this chance and I wanted to do this last time. You wanted to do that last time. So your health is actually a last priority. You're going to suffer, my friend. Anyway, so use that contact to book that. Okay? And thank you for that. Class number 3. Before I even forget, we have a 2-month weight loss group or program that is starting on the 15th, this Saturday, 15th of this month. Lasts for 2 months, because we do a 3-month program and then we alternate it with that 2-month program. So we are going to run a 2-month weight loss program this month from the 15th. No, next month from the 15th, right? Is it this month? This is February, yeah? Yeah, from the 15th of this month. So please, you can use the same contact. Use WhatsApp. Do not call. Do not send a normal text message. Simply send a text on WhatsApp. You will be responded to. So if you keep on calling, you will start blaming me. Oh, ijashikwa. We can't hold all those calls. Just simply post your concern, introduce yourself, give us your concern on WhatsApp, and then we will respond to you with a text that shows you how to book, and then we'll give you the attention. So the weight loss program starts on Saturday, the 15th. Keep booking. We already have people coming in, and it's tremendous. So yeah, join in and see how you can change your life for the better. Good. Group number 3 for drugs for diabetes. We call them the Meglitinides. Sometimes they are called the glinides, but the name is Meglitinides. Again, I'll write it down, Meglitinides. Meglitinides. So yes, Meglitinides, from just that name, Meglitinide, you will see at the end of the drug, we have nide. So these examples of these drugs again. Number one, yes, thank you so much, Maki. We keep moving. Number one, we have repaglinide. Repaglinide is famously known as Prandin. So if you have a drug that is called Prandin, now you know. That is repaglinide. Simply remember, read here. You don't read this big name, read these small names here. That's where repaglinide is. Number two, we have the netaglinide. Netaglinide is actually called Stalix. I know most people know Stalix and they're using Stalix, but they don't know it is netaglinide. Aye? Nani anasema na Ozempic tutaifikia Ozempic, don't worry. What are the mode of action of this drug? Just the same way the sulfonylureas act by increasing the production. Let me just correct this. Good. So the mode of action of this group of drugs is the same to the other one, the sulfonylureas. So they increase production of insulin. Anything that increases production of insulin is going to take you into hypoglycemia, is going to add you some weight, is going to cause you a lot of obesity. It's going to cause you very severe headaches, is going to cause you a risk of heart attacks, a risk of kidney failure, a risk of liver damage. But most importantly, this group is well known for constant flu. Now, if you're already diabetic, you know, you will constantly have a flu because of low immunity as a result of diabetes. And then now you take a medication that's going to cause you more flu symptoms. Problems, right? A lot of flu symptoms coming in as this. And then we have the joint pain. So these are, we could call them differential diagnosis in terms of the side effects. So one is the constant flu. Number two is the joint and the back pains. So you might think because I'm obese, I'm having these back pains. Of course, obesity comes with the back pains and the joint pains. But you see, this drug is going to cause you weight gain. And that weight gain is going to cause you more back pain and more joint pains plus flu. And then severe headache. So you can imagine somebody or ladies and women who are on hormonal contraceptives. Constant headaches and migraines every single day. And now you've put on drugs like the Stalix or netaglinide for that matter. And now these drugs are going to cause you more weight gain and more headaches. Are you going to survive? So don't you think the easiest way to just drop this condition is going and fixing the kitchen? Why are you even still arguing about fasting? Why do you want to eat 6 meals a day so that you can actually take a drug to lower the sugars? Does it make sense to you? Please, you might not hear anything I'm saying, but please do yourself a favor. Do not eat 4 times a day. Don't even eat 3 times a day. Ignore everything else I've said. But don't ignore the fact that eating carbohydrates is going to cause you problems. Number 2, that eating all the time is a serious problem. You are not designed to eat all the time. Every human being was designed to eat and then fast after eating. I mean, when do you ever digest this food? When do you ever utilize the energy from this food? When you're eating 5 meals and still snacking in between. Did you know snacking is actually eating? There are people who even tell me, you know me, I fast with an energy drink. I'm like, oh, you know me, when I'm fasting, I eat only nuts. Ask somebody, have you ever fasted before? They told me, yes, but it was a religious fast. And then I'm like, amazing, that's just a fast, okay. So tell me about it. What were you consuming during this fast? Oh, we were told to actually take yogurt and some nuts. Brethren, hallelujah, brethren. So you are fasting on yogurt and nuts. No, you did not fast. You are eating. I'm fasting on yogurt and nuts. Who told you that? You're either eating or fasting. Actually, fasting is the opposite of eating. Amazing. So those are the side effects of the Meglitinides. I'll go to the next group because I want to go faster because I've handled the best ones there. Good. There's group number 4 that is called the Thiazolidinediones. I'll type here because I don't want you to get confused. One day you'll come back and refer on this video. Thiazolidinediones. Very, very long name that you don't need to cram. You don't need to even take it anywhere. Simply once you've had diones, wacha nayo. Yeah? At least tuambie TZDs. They are called thiazolidinediones. Why bodybuilding? They say eat 6 meals in a day so that muscles grow. Listen, I have never had a chance to advise bodybuilders, and I will never want to do that. But you look at the bodybuilders, how they look. A lot of belly fat. They are very huge. They lift heavy. But no wonder most of them die from heart attacks. No wonder most of them get weird injuries because of ego lifting. They eat 6 meals, 10 meals a day. And then the crazy thing is they tell you, you have to eat carbohydrates to get energy. My friend, no energy is coming from the stomach. I explained that on a video that was talking about how the body harnesses energy from the muscle cells and from the fat cells. The body at the Krebs cycle level, it does not even know carbohydrates. It does not come to the stomach to pick food in the stomach to get energy. So please, this is a channel that is not for bodybuilders. We will allow this channel to simply be for people who want to lead a healthy life, become lean and fit, and not become fat and obese and lift heavy. Amazing. They will come after me, I know that. But I mean, when you see evil, you discern, you don't hate, right? Amazing. Let's go. So thiazolidinediones. In this group, we have a lot of them. One, we have pioglitazone. Pioglitazone is called Actos. So most of you know it as Actos because that's what your doctor writes on a prescription. Number 2, we have rosiglitazone, which is called Avandia. You've seen that prescription with Avandia? Rosiglitazone. Now, this group of drugs is normally combined with metformin. And these are the combinations that you people should know, and you know actually. One, when we combine metformin plus pioglitazone, which is Actos, we call it Acto plus Met. Ona venye wanachanganya. Very easy, right? Actos is pioglitazone, metformin is Met. So Actos plus Met. That is the name. So they are combining pioglitazone and metformin. Group number 2, sometimes it's called Competact. I see most people saying, oh, you know, I'm on Competact. This is what we mean. We are on metformin and pioglitazone. Number 2, we have glimepiride. Do you remember glimepiride? Do you remember glimepiride? The Amaryl. Do you remember Amaryl? That is glimepiride. So we combine Amaryl plus pioglitazone. Then we call it Duodact. So your parent is on Duodact. That's a combination of glimepiride plus pioglitazone. Number 3, we have metformin plus rosiglitazone. That one is called Avandamet because Avandia is rosiglitazone and then Met is metformin. So Avandamet, that's a combination. The last one is glimepiride, Amaryl again, plus rosiglitazone. It is called Avandil. Avandil, then mwisho wanaweka RY. So Avandaril. Hey, hey. Avandaril. That's a Luo name, right? Avandaril. Hey. So if you've not followed me, please follow me. So I'm telling you the combination. Why? Because I know you will see Competact and you wonder, what is this Competact? You tell your doctor, I'm on Competact. Some doctors don't even know what that combination is. Some of them will have to Google to see. When you tell me I am on Nava-M, I'm thinking, what is Nava-M? Nava-M is basically pregabalin and methylcobalamin. So this is the name. This is not a name. This is a brand name. Those combination names are not names for drugs. Those are names that are given to these drugs by a company like Triviamet. We are going to get to Triviamet next. So these ones, they act just like metformin, like the Biguanides. They increase sensitivity of insulin to cells. Again, we'll ask the same questions that we asked in metformin, right? So when you're increasing insulin sensitivity, you're making us more fat, you're making us more diabetic, and you just want to tell us directly that, you know what, as you take this medication, you expect yourself to grow fat, and one day you'll end up having complication of diabetes because we did not get sugar out of the system. We simply changed where the sugar is. We took it from blood and we pumped it into the fat cells. So most of your parents are on this combination of drugs. What they don't know is they are not removing any sugar from their bodies. They're actually changing sugar from the blood into the cells. That's weird, right? Very weird. It's a very, very evil system. Good. So what are the side effects of this group of drugs? The TZDs, the Thiazolidinediones. Number 1, fluid retention and edema. Your parents start swelling their ankles. And if they are on hypertensive medication, this drug that is in one group with nifedipine, amlodipine, they either swell their tongue or swell their ankles because of fluid retention. Now your parent is there with hypertension, taking drugs with the tongue. Haezi ongea bwana. Yeah? Okay, so that is number 1. Number 2, of course, weight gain is there, right? We can't miss out on weight gain. And then, of course, the nausea, vomiting, and diarrhea and constipation, they can't miss there. But increased risk of bone fractures. Now imagine this an old person who is taking these drugs for diabetes. And then they have risk for bone fractures. Bone fractures kill older people. When they just fall down and they get a fracture, dead. And this may be a woman who is in her 40s, is on hormonal contraceptives, already has weak bones, and then you give her this medication, more problems, more fractures, more hospital stays, and that's how we start extracting your insurance, slowly but carefully, very slowly and gradually. Because now we'll give you calcium supplements that will cause you hypertension, and now we'll give you drugs for hypertension. Now we'll give you drugs to prevent you from clotting. Yeah? You see how the prescription starts filling up? And now you wonder why this person has a prescription with 13 drugs. Now you know. Number 3, increased risk of cardiovascular disease. Now you've seen all through these drugs, all through these groups, there's an increased risk of cardiovascular disease. So we treat diabetes, we end up getting complication of diabetes, cardiovascular disease. Number 5, bladder cancer. Bladder cancer. Bladder cancer. And the most drug that is known for bladder cancer in this group is called the pioglitazone. Remember when you say the Actos? Pioglitazone. This is a drug that is totally known to cause bladder cancer. Now chemotherapy, and now steroid therapy, because now anyway. Next is liver cancer, and the last one is low immunity because of reduced white blood cell count. Sasa niwaulize Wakenya wenzangu na wananichi, hey, hii ni muratina. Unatembea 1 foot front, then you go 3 steps back. Ay. But cancers are also complication of diabetes. Anyway, I think I'm just tired. By the way, when I was just doing this research, and I was like, what? We struggled so much to cram the drugs in this group. You see how those drugs are complicated? In campus, we used to cram so much of this group. You want to be that star. In your head, you have these groups of drugs in your head, and the examples and the mode of actions. But we never cared about the side effects. As long as you have nausea, vomiting, and stomach upsets, and then you can throw there an allergy. Wachana na hii maneno. Wachana na hii, acha niweke hiyo kando. Tumeongea bladder cancer, liver cancer. Hey, sometimes hata nikiongea hivi na wewe ndio unameza hizi dawa. Hata wewe unashtuka. You're actually surprised. Why am I even taking this medication, right? And the desperation that comes with diabetes, my friends. The desperation that comes with diabetes. Yeah. You guys, please, take care of your health. Diabetes is no joke. No, it's no joke. I'm not selling you fear, because I've already told you the truth. It's not a joke. Anyway, group number 5. Now you thought that Thiazolidinediones is a long name. There's another long name coming here. We call it 𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗓𝗔 Wewe niambie, a pharmacy student in his prime, a pharmacy student in his prime has to cram this plus other things and go and sit in an examination to pass, and then ati atoke kwa class ameshika hizi vitu, ati akuja kupreachia huku nje, ataanza aje? You people don't even care about this classification. Do you care about dipeptidyl-peptidase 4 inhibitors? Do you? You don't. So akifungua chemistry yake pale polepole akule hata wacha akule. If he decides to open like a small pharmacy somewhere to just make sure that every evening you can bring in 50 shillings for one tablet no problem. Please understand that this was not a joke. Dipeptidyl. So group number 5, you thought that is the Meglitinides was a problem. Now you have to cram Thiazolidinediones. We have not even done with Thiazolidinediones for the cancers. We are now moving to dipeptidyl peptidase 4 inhibitors. All this name, the lawyer me will not see. Like where's Emma Tuki sawa? Good examples. Now here is where the issue now comes in, because you will have to know it anyway. So the drugs in this category, very, very common. Sitagliptin. They are actually called the gliptins. Sitagliptin. You know very well Januvia. You know very well Zituvio. These are the sitagliptins. Do you know the combination of sitagliptin plus metformin is what we call Triviamet? Hello? That person who was asking me Triviamet. Most of you nowadays is just Triviamet. The combination of metformin plus sitagliptin is Triviamet. Number 2, saxagliptin. So anything that ends with gliptin. Saxagliptin is called Onglyza. Number 3, linagliptin. Lina. Are there linas here? Linagliptin is called Tradjenta. Those are the names that you guys know, right? I'm taking Tradjenta. I'm taking Onglyza. Gliptins. There's another one called Vildagliptin. Vildagliptin is called Galvas. So there are people who are taking Galvasmet. Galvasmet is Vildagliptin plus metformin. Aye. Turihamwe? So metformin and saxagliptin, we call it Combiglize XR. Hey. Metformin and sitagliptin, either Triviamet or Janumet XR. So hizo maswali zenye mlikuwa mnauliza hapa ya Triviamet, now I've answered it. Metformin plus sitagliptin exists as either Triviamet or Janumet XR. Now you know. What is the mode of action? Of course, we've said dipeptidyl peptidase 4 inhibitors. That is an enzyme. Any word that ends with S is an enzyme. So they inhibit this enzyme called dipeptidyl peptidase. They inhibit that enzyme. When they inhibit that enzyme, they stimulate secretion of insulin. So why would you give us all these big names for no good reason? Just tell us these drugs produce insulin. They help us produce insulin. And then we will ask you, Daktari, if they're helping us produce insulin, why are they helping us produce insulin when we are insulin resistant? We are not sensitive to insulin. So why are we giving you more insulin? Number 2, why are we getting insulin to pump sugar from blood into the cells when we know that diabetes is what is in the cells, not what is in blood? You see that? So tell us something that we can actually get easier. And this is what doctors use to grow ego. So when they know these names, they'll stamp their authorities. Because you imagine somebody writing to you something like Combiglize XR. You're thinking, ay, ujamasi alisoma. Combi what? At least Triviamet makes sense, right? Like somebody writes this name, like which other name? Let me just see this one. Hey. Saa zingine madaktari wana stamp authority kwa barabara ingine yenye hata. Anyway, let's just continue. Side effects of these drugs. And I will tell you this for free. The drugs in the gliptin family, they are totally well known of causing cancer of the head of the pancreas. We talked about pancreatic cancer. Cancer of the head of the pancreas. But guess what? The pancreas is the one that is supposed to produce insulin so that you can actually handle blood sugars. So now we are causing cancer of the pancreas. So then how are we going to manage the production of insulin? Yet the same drugs are supposed to activate the same pancreas to produce insulin. Question marks, ndio? Question marks. Anyway, side effects. Number 1, joint pains. Just like the Thiazolidinediones. Number 2, pancreatitis and pancreatic cancer. Ngoja. Andika jina hii number 5. Of course. How did I forget that, Ann Masharia? Let me write that one down. Peptides 4 inhibitors. There we go. They are called the DPP4 inhibitors. The peptides 4 inhibitors. Hiyo peptides nimeongeza y mahali. Remove that y there. Let it just be peptides without the y. Let me just edit that. I can't edit it. Why can't I edit it? Anyway, yeah, toa hiyo y. Peptides 4 inhibitors. The gliptins. Sitagliptin, saxagliptin, linagliptin, vildagliptin, aka Zituvio or Januvia, Ongeliza, Tregenta, and Galvas. Amazing, right? Of course, digestive issues cannot lack there, but joint pains, pancreatitis and pancreatic cancer. Actually, there's a company that was, I don't want to mention that company, their sitagliptin was withdrawn because of serious pancreatic cancers. We have heart failure, very well known with saxagliptin. We have nasopharyngitis. Now, this is the respiratory problems. Again, you remember there's another group that we talked about, flu symptoms. But this one, constantly clearing the throat. So you can imagine if this is given to people who have asthma or people who are cigarette smokers. Problems, right? Now, if you're here, please, on YouTube specifically, 105 of you there, please just like the live. Okay? We want to finish the live with those 105 likes. That will make sense to me. So please, if you're there and you please just like the live. It's very important, okay? Good. Number 4, hypoglycemia. Of course, we are producing insulin, therefore hypoglycemia, therefore obesity is coming in, skin reactions are coming in, and risk of infections because of low immunity. Now, you might think I'm lying, but you go and take the leaflet in the drugs, in that pack of these drugs. Just take the leaflet and read the side effects of those drugs. You'll see all these things that I'm talking about. And then go deeper and research about those side effects. You'll see what I'm talking about. So that is group number 5. Group number 6. This one is interesting. So we have now a group that is mimicking glucagon. It's called the glucagon-like peptide receptor agonist. Let me just write it down. Hey. Glucagon-like. So they look like glucagon. Peptide. Peptide means coming from amino acids or from proteins. 1 receptor agonists. There we go. Glucagon-like peptide 1 receptor agonists. Anything called an agonist means it binds to this receptor and gives you the effects that is designed to give you. It activates that receptor to give you the same effect. Antagonists means it blocks that receptor and you get the opposite reaction. So these are agonists. So their mode of action, they mimic GLP-1. Basically, they are called the GLP-1 receptor agonists. So they increase insulin secretion. They suppress glucagon. So they suppress the production of glucose from the liver. That is gluconeogenesis. And then they slow down gastric emptying. So they actually slow down motility of food in the gut. Now, guess what? Your guess is as good as mine. This is where Ozempic is. 1, it stops the liver from making glucose. And number 2, it slows down the stomach motility, the gastric emptying, so that you don't absorb so much glucose from the gut. And number 3, it actually increases secretion of insulin. So start asking questions. I've done a video about Ozempic. You can actually go and check it out. But some of the questions that will come from this is, of course, the examples in this group. 1 is what we call liraglutide. Liraglutide is what we call Victoza in the markets. Victoza or Saxenda. Saxenda is very common. Number 2, we have semaglutide. That is Ozempic. In other countries, it's called Wegovy. This is a very common drug nowadays in Kenya. Every fat person is using it to lose weight. Every fat obese person in Kenya is marketing this medication. Every celebrity that is fat is marketing this therapy. And the weird part is they lose 8 kgs and then they grow back fat. Now you're taking an injection to lose you weight, but you've not changed your habits. Are you going to lose the weight? Seriously. Please. The last person you should actually follow, including me, people who are online. We can market you anything. And you can easily see somebody who is interested in money, they can market you anything. They are being given those injections for free, some of them, or half the price. And when they are given that, the target is not those celebrities, the target is you. Anything that is marketed, that means you are the product. So they'll use this small number of people, this small percentage of people, to make sure that the message gets to their followers. And their followers, because they are so hoodwinked, they just follow what they do every time. They will follow blindly. So they use these celebrities to actually make sure that you, who is the target, is actually captured. The same way they use people who are diabetic to make diet soda. So they make diet soda for people who have diabetes. So diabetics now can enjoy soda without worrying about raising the blood sugars. Do you know how many people ran to take that diet soda? People who are not diabetic. Do you know how many of them ran to take that soda because this soda is safe in people who are diabetic? And because it's safe in people who are diabetic, if I take it, I'll not get diabetes. So they don't care about the whole masses. No, they care about a small percentage of people, and they'll use those people to actually brainwash the entire masses. The same way they condition doctors in a syllabus. So your doctor cannot think about anything else. As long as he's in the syllabus, he has gotten an employment, he gets a good salary, and he has a white coat and a stethoscope around his neck. That doctor is now used to condition you. Somebody is saying Sandra Dacha and Pretty Vishy are culprits of Ozempic. There is another one who runs a podcast again. There's another one who runs a podcast. He's taking it. There's another one who is new now. The one who was left by the boyfriend the other day, the Luo boyfriend. She's now on it and she's telling you, I'm now 3 weeks into it, I've lost 4 kgs. You know her? People on TikTok, nyinyi ndo mnapenda mshene, mnamjua mrembo. This lady with a very, very round face. Aliachwa juzi. He introduced her new. Now we are waiting for the next new boyfriend, right? Because that's how they do it. Next new. We are waiting for the next new boyfriend for every celebrity nowadays. This introducing her next new boyfriend. After next new has decided, enough fat here. No, my friend, go lose some fat. Now they are busy injecting with semaglutide in their bellies. And then what they don't tell you is what they do after injecting that thing. They are there running on a treadmill like they'll die tomorrow. How can you be fat and go and run on a treadmill? How? You're going to hurt your joints. You're going to come out with arthritis. Now we'll put you on steroids. And those steroids will make you more fat. Oh, you should see these people, how they vomit, and they are given ondansetron to actually inject themselves to stop them from vomiting all the time. That's what they will not tell you. They will tell you, I've lost 4 kgs in 3 weeks. Give them time. Oh, they will never talk about it again. They'll never do that. So, semaglutide is the Ozempic or Wegovy. Liraglutide is Victoza or Saxenta. There's another one called exenatide. It's called Bydureon. And then we have daluglutide, which is Trulicity. Hey, Trulicity, is it? There's also a celeb called whose name goes like that. Trulicity. You guys know the licity. Yeah? The licity, Trulicity. The one who talks in slow motion. Hey, there's another one called Mounjaro. Hey, Mounjaro. Mounjaro is called Tirzepatide. Hata jina yake kuna appetite ndani. Mounjaro. Hey, so we have now Trulicity and then Mounjaro. Hey. So you remember this. The reason why people are taking this drug is for the sake of reducing gastric emptying. So they slow down absorption of glucose. But listen to me keenly. You know very well, these are the same people who will come later to complain that protein can sit in the stomach for 8 hours. Are they not the same people? So they'll take a drug that reduces gastric emptying and then they'll come and complain. When I eat meat, it stays in my stomach for 8 hours. That's them trying to defend the carbohydrate addiction. Look at the foods that they are eating. They're still eating the same foods. Oh, my friends. And let's talk about the side effects so that you can actually know why you should not consider that option. Weight loss is so easy as long as you put in the discipline. And the discipline is not easy as we say it. The consistency is not easy as we say it. You will drop one weight loss group to another. You will suffer the same consequences. Listen, the side effects, GI upset. And vomiting is very severe to an extent that you either swallow ondansetron or you take an injection for ondansetron. Hey. Anyway. Yeah? Somebody saying, I am on inosita. Inosita is a combination of metformin and sitagliptin. It's just the same as Triviamet. Yeah, it's a combination of metformin plus sitagliptin. Just a difference in the companies. Anyway, let's finish this before you ask those questions so that I can actually confirm this to you. Okay? Good. The side effects, number 1, GI upset, severe vomiting. Number 2, we have weight loss. The question is how? How can you lose weight when you have high insulin? Because this drug causes production of insulin. You lose weight because of malnutrition. You're starving your system because your emptying of the GI is very slow and the body struggles to pick up these nutrients from the food. So you're actually starving your body to lose weight. Very unhealthy way to lose weight. Number 3, but I'm not telling you to stop with that medication. Go and take it. If you want to, that's your own problem. Or that's your own business. I'm not involved. Mine is to open up your head so you can see the bigger picture. Number 3 is pancreatitis. So again, the confusion comes in here. We are producing insulin and then we are failing the same pancreas. Does it even make sense to you? Anyway. Number 3 is dizziness and severe headaches. Number 4 is the high risk of thyroid cancer. Aye. Number 4, high heart rate. Call it tachycardia. Number 5 is insomnia. No wonder they are taking the diazepam tablets. No wonder they are taking the antidepressant that is called what? Amitriptyline. And then anxiety, of course. Amitriptyline is also coming in handy to reduce the anxiety. Sometimes they take propranolol, a drug for hypertension, to ease up on anxiety. So these people will not tell you all these things. So every side effect comes with a different drug. And doctors know very well. So they know you will experience this side effect. So they tell you this comes as a package. When we give you this drug for weight loss, we will give you other drugs to prevent you from getting these side effects so that you can actually get better. You know, we don't want to hurt you so much. So understand that you're going to give you this drug, but it comes with other drugs as a package. Oh, and then you get a thyroid problem. And now every single system in your body shuts down because the pancreas plays a role in every single organ system. The 8 of them, they rely on the thyroid. Now you'll have problems with vision. You'll have problems with fertility. And you can see the ladies who are taking this medication for weight loss, they are very young. There are people who can actually put in the discipline, but they don't want to. They want the shortcuts, but they're wondering later, 5 years down the line, they are now taking supplements for pregnancy. They can't get pregnant. If they get pregnant, they can't maintain the pregnancy. The same ladies are the ones who are actually constantly taking hormonal contraceptives because of their sexual behaviors now. And if any case, the reason why they are taking this medication is because somebody told them they are fat. And now they are constantly proving a point to that person in their head. External validation, trying to prove a point to somebody who is in your head. This person does not care. If you're fat, you're fat. Fix it. Just change the kitchen. You know very well, if samosas pass by, you want to pick samosas. You want to eat sausages. You want to stock a fridge and tell us how you stock the refrigerator with 30,000 shillings of shopping. You're the one who is telling us these things. And then now, when we question your fatness, you start telling us, oh, you know what, because you want to conform to us, you'll go and take this medication to take a shortcut. Now you're here telling us, oh, you know what, I realized I'm not doing okay, I decided to take this injection. Because you know what, I've done everything. And that's what they use. I have done everything. And I was told I have hormonal imbalance. My friend, they didn't tell you have hormonal imbalance. They wanted you to buy the medication. Smocha, yes, they are always taking these smochas and all that. This is a person who ice cream cannot pass them. They eat literally everything, and then now in the evening they have a fruit pudding. I'm just trying to detox with fruits. Me na detox na fruit pudding. Kiwi is very good for detox. I do as smoothie of and then I put in some honey. Where? Yeah? And now you want us to say, oh, pole, you're fat. Oh, no, you're not fat. You're chubby. You're chubby. You're not chubby. Take responsibility of what is going into you and what you eat. Don't tell us I've done everything. But when we ask you, what is your kitchen like? You're showing us the same things that actually made you fat. So you think taking that injection is going to change your life. Yet you've not changed that kitchen. Oh, I'm plus size. I even saw in Kisumu there was a show at the plus size models. I'm like, plus what? Nowadays, we even have in these fashion houses, we have obese dummies. Dummies with the pot belly for men. Men who wear 3XL shirts. Now we have a dummy for you that is putting on that shirt. So you see it and you say, kumbe hata kuna dummies zetu. Let me put on this. Lose weight, my friend. So they've made it intentional that you eat those foods. They have made these foods very available to you and very addictive to you. Once you eat those foods, you become fat, and now they come with a solution. Because they know you are gullible. They know you are easy to hoodwink. They come with a solution, which will bring you more problems. Of course, after those problems, there's a solution. One problem after the other, one solution after the other. You've eaten our food. Don't worry. 7 years down the line, you're fat. You're not fat. No. Don't allow them to call you fat. They are body shaming you. You're not fat. You're chubby. And we have a solution for chubby people. Why are they having a solution for you for chubby people? Why is there no solution for lean people? We have a solution for you for chubby people. Take this injection. Take this other medication to actually guard you from side effects of this injection. Then you're like, by the way, the companies care about me. Imagine they gave me that at half a price. Sometimes they suck fat from your stomach. And you still eat the same foods. You're still just tawe. Now they have to remove fat from your thighs and fill up from the places where they messed up. Mkona pesa. And I can tell you, 5 months into a weight loss program, without having to spend 100,000 shillings, you lose weight. 5 months. You can't eat food worth 100,000 in 5 months. You can't. Am I crazy? You give me a job, nisafishe hiyo fridge yako, tuone kama utakula food ya 500,000 in 5 months. Uongo. Niache hii kazi nafanya. Niende huko Maseno, nipande milima nikichunga mbuzi. 500 5 months, 100,000. Food. Which food? I buy you 5 tins of ghee. You start telling me, ghee inanukanga vibaya. Ghee hainuki vibaya. Wewe ni addict wa chakula mbaya. Nyinyi ndio wale mtakuwa mnaniambia ati diabetes is in the honeymoon stage. Anyway, you're lacking sleep, but you've injected, so you're always on Mshene's platforms on TikTok at night. When we are sleeping, uko Mshene TikTok. Unaona usingizi, you're sleeping, you're telling us, Mia, I give up. Anyway, the last one. Should I take the last one or should I leave the last one? Anyway, the last one is called sodium glucose cotransporter. Sodium glucose cotransporter 2 inhibitors, basically SGLT2 inhibitors. Hapa kuna kadhaa. Kuna empagliflozin, which you people call Jardiance. Number 2, we have dapagliflozin, we call Foxiga. Number 3, we have canagliflozin, we call it Invokana. Number 3, we have sotagliflozin, we call it Impefa. So kama uko na hizo dawa, if you have those drugs, if you have Jardiance, if you have Foxiga, if you have Invokana, if you have Steglartro, if you have Impefta, those are what we call the SGLT2 inhibitors. Basically, they are called the flozins. They flozins. Empagliflozin, they flows. Empagliflozin, Jardiance. Dapagliflozin, Foxiga. Canagliflozin, Invokana. So 𝗪𝗪𝗡𝗧𝗏 impefa, now you know. These ones, they reduce. Actually, this is the only group. You remember I told you when we were starting that there's one group that causes removal of glucose from the body through urine. This is the group. Okay? So this one causes excretion of glucose from your urine or through urine. So listen to this. They block reabsorption of glucose in the kidneys, leading to glucose excretion in urine. So you excrete glucose through urine. That is a danger because that is glucosuria. Now guess what that is going to expose you to? Urinary tract infection. Recurrent urinary tract infection because glucose is in urine and fungi survives on glucose. Now you'll constantly be in hospital treating recurrent urinary tract infection. So I give you this drug and I know you'll come back with urinary tract infections. I'll give you another drug. And then when you're excreting sugar from the kidneys all the time, you're going to affect kidney function. Therefore, kidney failure, dialysis is coming. Kidney transplant is coming. More drugs. In terms of steroids to suppress the immunity from overreacting to the new kidney. Now you'll be on drugs for a lifetime. So therefore, the side effects, as you excrete glucose through urine, dehydration is coming in. When you dehydrated, acidosis, heart attack. You see that? Kidney failure, heart attack. Amazing stuff. You need to understand this to combine all this information. Now I know that this is so much in one class, but again, I want to do away with this unit totally because we want to talk about other things also some other time. So dehydration, recurrent urinary tract infections, hypotension, low blood pressure because you're excreting glucose and getting dehydrated. So hypotension is coming in. And then we have ketoacidosis. Now this one is going to give you high acids and high ketones in the system because your body thinks because you're excreting a lot of glucose, you're actually starving. But you have high glucose in the system. So the body now turns to the fats to burn fat to give you ketones. Now you have glucose plus ketone bodies. That is now diabetic ketoacidosis, a side effect of drugs for diabetes. So therefore, when you're telling me when you fast you get DKA, I'm telling you drugs for diabetes are causing you diabetic ketoacidosis. Another one, risk of amputation, specifically for the drug that is called canagliflozin. Kana. Kwa Kikuyu, kana. Hako kana. Kana flows na hapa, haka kana. Kanaenda kukuletea risk of amputations. Of course, most of these drugs of diabetes cause you risk for amputations because they simply pump sugar from blood into the cells. More problems. Anyway, bone fracture is also coming here. Kidney failure is coming here, and hypoglycemia. Why? Because you're excreting a lot of glucose from your urine. Now, is this the road that you really want to take? If you're already diabetic, you've already been diagnosed with diabetes, this is your road, you have no option. But as you enhance this road, as you follow this road, start changing that kitchen. Do away with the causes of diabetes so that you don't have to manage the symptoms of diabetes with medications. Oh, I know this video will not go far. I know this video will be demonetized as soon as possible, as soon as I end this live. I know. But you who is here, you've gotten it in your head. They will change what is happening on my YouTube channel, but they will not change what is in your head right now. Oh, they will not. They will not change the truth. They can't stand between the path of truth. Hallelujah, brethren. Sadaka tu ndo mtoe sasa. Sadaka mtoe. So anyway, thank you so much for being here, liking the live, showing much love, answering questions, asking questions, and it's just amazing. It's just amazing to have you as an audience. You've taken us to heights that we never thought we'll get to. So allow me to tell you this. If you are diagnosed with diabetes, or if you call yourself, I am diabetic, listen to this. Avoid sugar in all forms, including fruits and honey. Number 2, brown is not better than white. Brown is not better than white. Your body does not know colors. Your body, your liver does not know colors. Your body knows the nutritional value, the slightest part of that. So brown bread and brown ugali, all of them are going to yield glucose. Number 3, the only reason why you're taking drugs for diabetes is because you're feeding the disease by eating excess carbohydrates every single day. Some of which you don't even know are carbohydrates, like beans, like milk, like fruits, like honey. You didn't know they are carbohydrates. So the only reason why you're constantly taking those drugs for diabetes is because you're feeding the disease and you're unable to change the source of your foods. Understand, no food comes from an industry. Whatever is coming from an industry is a product. Food comes from the soil and from animals. Number 4, Diet soda is not soda. It is not supposed to be taken. Wachana nayo. Yani hata see it is not soda. Diet soda is not for everybody. Leave alone that it is for diabetics. There's no soda for diabetics. There's no soda for people. It's a product. Stay away from product. Eat foods. Number 5, fruits are sugars. Fruits are sugars. Stop telling me this is natural sugar. If I eat sugar cane, I've taken natural sugar. If I eat fruits, they are natural sugars. The body does not know the difference between natural and synthetic sugar. The table sugar is glucose and fructose. The body knows glucose and fructose. Sugar cane is glucose and fructose. The body knows glucose and fructose. So the body does not even know you took sugar cane. Number 6, eating all the time is criminal. Snacking is also eating. Whatever you take, whatever you use with that information, that is up to you. Number 7, even with medications for diabetes, you will still get the complications of diabetes. Kidney disease, heart failure, weak bones, hormonal imbalances, specifically PCOS, obesity, strokes, amputations, nerve problems, erectile dysfunction, vision problems. Okay, let's continue. Number 8. But this is not a warning. This is a reality. My advice is not here to substitute your doctor's prescription. My advice is to make sure that you get the clear information, and whatever you do with that information is up to you. So do not drop medication today and say, Dr. Lewis said this. No. I have said a lot of things about diabetes. If you are very keen at this moment in time, if you've been diabetic for six months, 1 year, 5 years, the problem is just you. You are unable to put in the discipline, the consistency, and the patience. CPD. Another one. For those of you who are taking insulin, ask your doctor a question. That if I am type 2 diabetic, I have insulin insensitivity. I am resistant to insulin. Why are you giving me more insulin? I rest my case. Book an appointment with us. 0707-074722. We will help you win these battles. Number 2, go and join all my platforms. And if you are here, 101 of you on YouTube, please like the live. Thank you so much, everyone who attended this live. We finished this live at 208 people on TikTok. That's amazing. 1 hour 48 minutes down the line. Hiyo nini unakunywa? Hii inakunywa tu maji. Maji na chumvi. There's nothing here, my friend. I used to take Jack Daniels back then when I was that guy. But I said nimeokoka na kuamini maji ni maisha yangu. So this is just water. So please, 0707-074722. That is our contact. Book an appointment with us. Use that line. Text on WhatsApp. Text on WhatsApp, I repeat. Use that contact to book your online and physical appointments that are coming in at the end of this month. Use that to book in online appointments that happen every single day. Use that appointment to book your slot for the 2 months weight loss program that starts on 15th. Change your life for the better because you deserve it. Now, my name is Dr. Lewis Muchile Obunde. Thank you for being an amazing audience. We can't do this without you guys. We will see you on Friday on the other platform. So go and subscribe on that other platform. It's called Hose with Dr. Lewis. Or simply type Dr. Lewis. You'll see it. It's a new platform there, about 1,680 people. Go there and subscribe on that channel. We will see you on that channel on Friday for Identity Fridays. Bring that anger there. We need to fix your anger. We need to fix your insecurities. We need to fix your depression because you don't have depression. You've been told and convinced that you're depressed. You're not. We want to fix the relationship between you and your creator, aka your biological father. We want to help you overcome the evil spirit inside your hearts so that you don't keep on seeking validation from people and from things outside you. We want to make you focus on the present. We want to make you fix the inside world so that you don't care about the external world because your real reality is happening inside you. So this is to those people who don't understand the gospel that I've constantly been preaching here about identities. Now it's time for you to take a chance on that platform and see if you still ask the same question. Thank you so much for being an amazing audience. I wish you a good night and we'll see you on Friday. Amazing.